Dr. Pollard is founder and director of the Center for OCD and Anxiety-Related Disorders at St. Louis Behavioral Medicine Institute and Professor Emeritus of Family and Community Medicine at St. Louis University. He's a licensed psychologist who works with a range of obsessive-compulsive and anxiety-related disorders with a special interest in patients ambivalent about or resistant to treatment, which is really an underserved area of research and clinical work. So we're really excited about the work that he's doing. He's on the Scientific and Clinical Advisory Board of the International OCD Foundation. He chairs the organization's training subcommittee, including a national training initiative called the Behavior Therapy Training Institute, the BTTI. This is the premier offering that trains therapists to do proper work with OCD, because there's a lot of therapists out there who think they know how to treat OCD and they do not. Most of the people on these front tables that are part of the board or my practice or Dr. Marlowe's practice, Marlowe's practice, have been through the BTTI, including myself. It is really an amazing experience for those of you who are clinicians, but they tend to sell out literally within 45 minutes, no matter where in the country they advertise that they're going to be having one, so you have to be on top of that. He is former chair of the Clinical Advisory Board of the Anxiety and Depression Association of America, ADAA. He serves as a reviewer of a number of professional journals and conference program committees. He's authored over 100 publications, including 2 books, The Agoraphobia Workbook and Dying of Embarrassment, Hope for Social Anxiety and Phobia, which is the Bible that we use in my practice with anybody who walks through the door who has social anxiety disorder. It's really a great workbook. And he's currently working on a book to help the families of OCD treatment refusers. Please join me in welcoming Dr. Alec Pollard.
Well, thank you. What a nice introduction. Could you please call my mother and tell her that
I'll send her a copy.
She swore I would not, make it in this world. Just kidding. She's very supportive. In case any of you know her. Well, I am actually just delighted. I was so excited when Alan offered to bring me here because, believe it or not, I was born in New Jersey. In Inglewood Hospital. I don't know, is it still around?
Yeah.
Okay. A few years ago. Okay. So, and I'm staying in the hotel, the Marriott, that's in the middle of the airport at Newark. And Alan was very concerned that I would generalize to the entire state of New Jersey the ambiance that I was surrounded by. But I assured him that I have a full appreciation of the varied fruits of New Jersey. My wife and I, our first place we went to together, our first trip, just the 2 of us, was in Cape May. And as I understand it, it's still in New Jersey. Is that correct? We have very good friends who used to live in Mountain Lakes. We used to like to go up there and visit them in that very beautiful area. And I spent a year, when I first drank the Kool-Aid in the OCD area, it was in Philly, and of course we would go over to the areas of Cherry Hill and other parts, so Princeton. So I think I have a pretty good sampling of New Jersey. I promise you all, I will not generalize from the hotel in the middle of Newark Airport my impression of New Jersey. And this is a very lovely format as well. So I'm very glad to be here. So I wanted to start with Stephen Wright. Some of you may know him, but I just thought this, I just happened to be hearing him one time. I thought, oh my God, I got to put this on a slide. It's so perfect. But I can't do the delivery like him. He's got this just real dry kind of, talks like this. In school, they told me practice makes perfect. Then they told me nobody's perfect, so then I stopped practicing. That's kind of the way he does it. Not anywhere near as good. So I'm going to tell you that the lining up of this is on purpose because of the talk. It is also possible I screwed it up, but you'll never know. So here's what we're going to do today. We're going to first talk about the general nature of perfectionism in general. and what we know about it. And then we're going to dive into academic perfectionism, and then we'll go to occupational perfectionism, and then we'll talk a little bit about treatment, and then we'll have a very in-depth case illustration that really gives you a good sense. You should leave here with a good sense of how we apply OCD treatment models to perfectionism. And now, whether these will coincide with the divide before lunch or not, I have no idea. I'm just hoping it does. So let's start with the general nature of perfectionism. By the way, I should say, anybody in this room actually perfect themselves? Just raise your hand. So I'd like to ask you to leave, please, if you would, because you're intimidating the rest of us. Okay, good. Then all the rest of us are mortals. We're in good company. All right. So a little history. I like to give a little historical and very, very brief history. Early on, the first people that wrote about perfectionism were a couple of psychodynamic theorists. Karen Horney called perfectionism the tyranny of the should. And that's actually kind of rings true today, doesn't it? We always talk about shoulds in our field. By the way, how many clinicians are here? You can raise your hand. Okay, we can put those down now. Okay, so for those of you who are not clinicians, I should ask the clinicians to cover their ears. If you really want to drive a therapist nuts, use the word should. They hate that. So I always had a fantasy about pretending I was a patient and just going in and shoulding all over the place. Watch the therapist. They sometimes actually have seizures in response to the word should. They hate it. Adler also talked about it. Now, this will be a theme throughout today. We're talking about is perfectionism good or bad? You probably know now the answer's yes and no, but I gave away the whole thing now. You can go home. So Adler said, yeah, so Horney really just, by the way, it is pronounced Horney. Just want to be clear. Adler did recognize that it was a dysfunctional thing, but mostly talked about some of the positive aspects of perfectionism. So we're going to kind of sort that out. Still today, that's some of the things you see discussed in the literature. And then really not much happening until about 78 when Hamachek made this distinction between normal perfectionism and sort of neurotic perfectionism. So here you start to see the divide between what's healthy and what's not healthy, and starting to identify that. And then shortly after that, David Burns produced the very first measure of perfectionism, called the perfectionism scale. And that was totally focused on negative stuff. By that, I just mean things that are dysfunctional, problematic. But it didn't capture some of the positives. So you'll also see two things in the literature that that kind of divide. You'll see the clinically oriented folks who do primarily focus on the dysfunctional aspect of perfectionism. And then you'll see more of the academic personality researchers who are looking at a wider concept of perfectionism, and they make distinctions between things that are adaptive versus things that are not adaptive. And so it can be a bit confusing to read the literature on perfectionism because there's so many terms and so many concepts. You can really bog you down. So I'm going to attempt to simplify it so that we can all digest it. We'll see if I do a good job of that. I hope so. But for those of you, by doing so, I'm going to leave out a lot of literature. So those of you who would like to go over those 500 graphs and tables and things from the literature, I'll stay after at 3. We'll go over those over detail. Yeah, okay. You have to be careful because statistically, at least one of you just believed me and will be standing up here at 3 o'clock. You know who you are. It actually happened to me one time. I was making that joke about saving people research slides, like you don't have to go over 500 because I'm summarizing them in one thing. And but if you want, I'll go over all of them at 5 o'clock. And sure enough, one guy's standing there. I'm answering questions. And I said, "Sir, can I help you?" He goes, "Yeah, I'm ready to go over those research slides now." So I handed him the remote and went to happy hour. So then the academics, the personality researchers got really involved and started developing a number of different measures, measuring different aspects of perfectionism. And really in the last 25 years is where most of what we're going to talk about today the knowledge has been developed in the last 25 years. So let's talk about what being a perfectionist is not. I think we all know this, but let's just be clear. It does not mean you're perfect. It does not mean you think you're perfect. It doesn't mean you're perfectionistic about everything. And even the things you're perfectionistic about, your behavior may not look perfectionistic. So a patient might say to me, "Well, I can't be perfectionistic because my room's a mess." And at surface, that looks like, no, I guess not, you're not. But in fact, the reason her room's a mess is because she knows that if she starts to straighten it, it's going to be a 5-day ordeal that is so overwhelming to get that room exactly perfect. It's actually easier to get by that day with the hope of eventually making it right than to actually tackle it to make it right. So indeed, even though her room's a mess, she is a perfectionist. So let's talk about what it is. Now here, you'll see two good examples of this sort of divide between the academic, the personality researchers, and the clinicians. Roz Shafran's group, and she's, at the end I'll recommend some books for you if people want them. She's one of the authors of one of the books. Her group is based out of London, and Roz's group is largely clinicians who are doing research, but they're clinically focused. And so you see this reflected in her definition. There's the implication of dysfunction. Because as clinicians, what we see, we don't see high-functioning perfectionists. They don't come to our clinic. People don't, I don't know if you know this, but people don't go to therapists unless they're suffering. Except if you live in California, then you might go to be a better person or something, I don't know. I still don't understand that. So here's the setting of and striving to meet very demanding standards that are self-imposed and relentlessly pursued despite this causing problems. See, immediately, this causing problems. So their definition of perfectionism is by definition dysfunctional. It involves basing one's worth almost exclusively on how well these high standards are perceived and achieved. Now, in this next definition by Stover, and he is one of those leading personality researchers in perfectionism, he calls it a multidimensional personality disposition. Now, multidimensional implying that some of those dimensions are functional, some are not. Disposition characterized by striving for flawlessness and setting exceedingly high standards of performance, accompanied by overly critical evaluations of one's behavior. Now, he starts to get at it like you're overly critical of yourself, but he's not saying it's dysfunctional. He is saying that, and there's a reason for that, because researchers, they don't want to assume something. They want to objectively describe the phenomena and then see if it's dysfunctional, but not have it in the definition. So that's one of the differences between the more clinical definitions, where we don't really care about functional perfectionism as clinicians because we don't see that. We only see dysfunctional, so that's all we care about. Whereas personality researchers want to see the bigger picture. So back to that question, is perfectionism all bad? And the answer is it depends on how you define perfectionism. If you define perfectionism, if your definition focuses on dysfunctional perfectionism, then it is all bad. And if you have a wider, broader definition that looks at aspects of perfectionism perfectionistic kinds of behaviors that may be not dysfunctional, then it's not all bad. So you'll see terms in the literature, I think I've covered most of them, there may be some others, but you'll see different people writing using different terms. So they'll say adaptive versus maladaptive perfectionism, healthy versus unhealthy, functional versus dysfunctional, positive versus negative, perfectionism versus the pursuit of excellence, which is what we use in our clinic, personal standards versus evaluative concerns, and then very similar to that is this last one, perfectionistic strivings versus perfectionistic concerns. And this is the term that is sort of won out among personality researchers, so to speak. So a lot of the research on multiple factors kind of come down to two factors in perfectionism. One is what's called perfectionistic strivings, and the other one is what's called perfectionistic concerns. And as you can see from the pictures, you can probably guess which one might be associated with dysfunction. So if your behavior, if you strive for high standards and you are meeting, if not meeting them, your behavior is functional and you're striving towards that, and there's not an excess of anxiety and immobilization, then it's functional. On the other hand, number two is perfectionistic concerns, where you are worried and anxious about perfectionistic issues, and that can lead to behaviors that are not consistent with functioning well. So the bottom line is, number one is probably perfectionistic strivings in the literature as you read it is more often associated with high functioning, and perfectionistic concerns is more often associated with not so good functioning. Oh, that's odd. That should be whiter. Can you read it? At any rate, so in our clinic with patients, we try to make a distinction between a perfectionist and a pursuer of excellence, which is the alternative, and probably would correlate with perfectionistic strivings in the personality literature. The problem, we can't say that's for sure because all of these things emerged from different camps at the same time, and so they haven't been joined together and studied. But I would suspect that what we call the pursuer of excellence is very similar to somebody who has perfectionistic strivings, and that perfectionism, the way we're defining it, is very much like someone who would have perfectionistic concerns and anxiety. So we make these distinctions, and this is for you clinicians, this is very important, because for many of the folks who are perfectionistic who will come to see you, as you may know already, the alternative to perfectionism is complete degradation in their mind. Of course, I cannot give up my perfectionistic strivings because then I will be irresponsible. And again, on occasion, perfectionism is associated with all or nothing thinking. Okay, not on occasion, like a lot. All or nothing thinking. So if I'm not striving all the time to do this right, then the world will end. I'll become irresponsible, I'll be decadent, whatever catastrophic term they may use. So it's very therapeutic to offer them an alternative to perfectionism that isn't degradation and irresponsibility, and show them to highlight the differences between adaptive perfectionism and maladaptive perfectionism. So here we have just a few. There you can add some or subtract, but a perfectionist sets unobtainable goals. A pursuer of excellence sets high but potentially obtainable goals. A perfectionist maintains goals despite their experience. In other words, they don't correct their they don't correct their goals based on experience. If they discover that they can't do something under certain conditions, they don't change their goal and modify it to be more realistic. They just keep holding on to that goal despite all the evidence from their experience that tells them it's not realistic. And of course you could say, well, who cares if that motivates me? Yeah, but it doesn't motivate you indefinitely. It might motivate you for a while, but then you'll burn out because you'll keep failing and you'll get frustrated, and then you'll turn on yourself and be critical. That's another thing. Perfectionists tend to be just a touch self-critical. Just a touch. The pursuer of excellence modifies his or her goal based on experience. So, okay, that was not realistic. There's no sense setting that as a goal. I am not going to be a professional basketball player. I want you to know that. And I finally come to terms with it last year. Okay. So it would be ridiculous for me to have that as my goal. Now, if I wanted to be like the best guy at the Y, maybe. Among my age range, maybe. Maybe. Who are 5'9", maybe. Okay. So that's the other thing, that setting unrealistically high goals does not maximize performance. And this is hard for people who are perfectionists to get this. You do not perform better when you have really high goals. You don't. And at best, you may tie the person with realistic goals, but then eventually you burn out, and the other person keeps going. A perfectionist judges self based on exclusively on the outcome, whereas the pursuer of excellence judges themselves on multiple criteria. So, for example, the idea of saying, you know what, you didn't reach your goal, but you did the best you could, and you learned a lot from this. You would never hear a perfectionist say that. I didn't do whatever. I didn't get my A in class or whatever it is, so it's a complete failure. I'm a loser. And this is another interesting thing about perfectionism is antithetic to learning. In other words, it's the opposite of what the attitude you need to learn. Because the self-criticalness and the tendency to ignore the very fundamental fact that making mistakes is absolutely essential to the learning process. You cannot learn without making mistakes. Otherwise, you already know the thing and can do it perfectly. So you have to make mistakes, and then you have to evaluate the mistakes so that you can learn from it. If mistakes are evidence of your unacceptability or your inner character being horrible or you being unacceptable as a person, if a mistake is some sign of that, then you can't objectively analyze the mistake. You're too busy criticizing yourself. Picture this, for example. Let's say you're an 8-year-old child and you took a math class, you took a math test, and you didn't do so hot. So the teacher comes over and supports you and sort of says, well, let's try to learn. Let's look at a couple of the problems and see what you were missing, where the mistake is. And they go over it. And then together, the teacher helps the student learn that, oh, I wasn't carrying over the number into the next column or whatever the problem was. And then corrects it. Now, picture that same child with the teacher coming over going, I can't believe you didn't make that. That's just stupid. What is wrong with you? The other kid, you should know this by now. Why are you? And imagine the student this teacher standing over the student, yelling at the student and criticizing the student while the student's trying to learn. And completely incompatible. And sometimes if you make that metaphor, it helps patients see that if you're the teacher doing that to yourself, how is that helping you learn and grow as a person? It's not. See, this is not about pie in the sky being positive. Good CBT is not about being positive. You can take that to extremes too. It's about being functional. Not criticizing yourself at a time when you need to learn is a good thing to do because it's functional, not because it looks bad because you're being mean to yourself. There are times when being overly positive is dysfunctional. You know, if I just robbed a bank and then I went and looked in the mirror and said, you know what, you're a good person. Just because you robbed a bank doesn't mean you're not a good person. And you're good enough, people, gosh darn it, people like you. Some of you know where that's coming from. All right, a perfectionist is motivated by fear of negative outcomes, and that's really a very, very important one. Whereas a pursuer of excellence is motivated by positive outcome. So in other words, you hear in sports a lot of times they were playing not to lose, as opposed to playing to win, and I think it goes at that the worst thing in the world is to lose, and so all of your energy goes into not losing or not failing, as opposed to succeeding or learning, even more importantly, learning. And that really flies in the face of all we know about what it is to become better, to learn, to grow as a human being. So my wife loved Walt Disney. She read about him, and she told me that he went bankrupt 4 times before he was successful. And each time, you presume that he learned something. So if he had been a perfectionist in the dysfunctional way, we would never have Mickey Mouse. I'm sorry, I'm all right. Okay. And then my grandkids and I would feel kind of good. We were at Disney World last year, and we just feel kind of goofy walking around going, there's nothing here. Why did we come here to Orlando? So, all right. So I want to talk about 3 other perfectionistic concepts that you'll see sometimes in the literature, and mainly so to keep you from getting confused. Like, what is this thing? He didn't mention that. There's a thing called other-oriented perfectionism. So this is where you expect everyone else to be perfect, and you hold everyone around you to some high standard that is equally unrealistic as a sort of regular perfectionist might have for themselves. This is not considered the same as perfectionism that we're talking about today, but I just wanted to alert you to it. And there's a whole other area of research on what this is about and why do people do that. And it's sort of considered, these are people, they're generally not popular, as you might imagine. So you don't want a manager or a boss or a supervisor like this. Run if you get one. Then there's something called perfectionistic self-presentation. I couldn't think of anybody better than Will Ferrell and Anchorman. How he is always trying to present this image of himself to others, being perfect. And this is shortly before he was asked by the jazz band to come up and play the flute. I don't know if you remember this in the movie, but which of course he played perfectly. But this is where your investment is on the presentation of yourself as being perfect to other people. So the tendency is to exaggerate your accomplishments, to downplay to not mention anything that could reveal you as being imperfect in any way. And then we have a concept called perfectionistic cognitions, which are those anxious sort of deliberations and dwelling, those scary thoughts you have in the heat of the moment of being triggered by some perfectionistic concern. Now, that's a little different than perfectionistic concerns that I mentioned earlier, because that's more of a personality tendency. So for those of you who are clinicians, that would be trait versus state. So in other words, you have this personality of concerns about perfectionism that are tied to sort of fundamental beliefs about how the world works. Perfectionistic cognitions are those automatic thoughts you get in the moment when you get anxious and catastrophic thinking about something that won't go right or won't be perfect. So let's talk about the measurement of dysfunctional perfectionism. And I don't want to, I'm going to sort of give you references. There may be a few of you who really want to look into this, but I don't want to spend a lot of time on it because it's pretty dry, to be quite frank. And it is Sunday. We can't take too much dryness. So there are no instruments specifically for academic perfectionism, no really well-studied, psychometrically sound instruments for academic perfectionism or occupational perfectionism. But there are measures of perfectionism in general, and there may be some items on some of those forms that refer either to academics or occupational perfectionism. But if, as clinicians, if you're looking for a measure of either one of those domains of perfectionism, that we don't have one, so you'll have to settle for one of the general measures of perfectionism. So if you see at the top one is Burns's first, the perfectionism, his scale, and all of these forms are self-report as far as I know, and it measures that sort of negative, a general characteristic of negative perfectionism. Then after that, you'll see some of the measures that came in the second wave. So when Burns had his first sort of looking at only at negative perfectionism, and then all the other personality researchers and clinical researchers started to look at other aspects of perfectionism. And Randy Frost, who some of you know, his group was looking at, developed what they call the multidimensional perfection scale, and it's a very good scale. And then Hewitt and his group has another one. And one of the differences really is that they all kind of came up with subtypes of perfectionism and their own words and categories of things. And it can get really confusing trying to sort it all together. And most of you don't have to be concerned about it. These are all the measures that eventually they were able to pare it down to those two fundamental factors, which really basically translate into adaptive perfectionism and maladaptive perfectionism, quite frankly, although they're called perfectionistic strivings versus perfectionistic concerns. But you can see now, here's another whole page of perfectionistic cognitions inventory. Fleet and Hewitt, those guys, this is a measuring of those cognitions I'm talking about, your tendency to have catastrophic thoughts in moments where there's a task demand for performing well. And the almost perfect scale, I like that name, almost perfect, also discriminates between